Assalamu alaikum. So today folks we will go through the drugs that are antifungal in nature. On the basis of their mechanism of action, they can be divided into four categories. First category is about the drugs that alter cell membrane permeability. In this category we have three classes: azoles, polyenes and terbinafine. Second category is about the drugs that block synthesis of beta glucans. Here we have echinocandins. Next category is about the drugs that block synthesis of nucleic acid, like we have flucytosine. Fourth category is about the drugs that disrupt functioning of microtubules, like we have diacylfulvin. Let's see a diagram. Focus on this diagram in order to understand the function of antifungal drugs. Here mentioned almost all the drugs target fungal cell wall or cell membrane except the two, flucytosine that blocks the synthesis of nucleic acid and diacylfulvin which disrupts the microtubule synthesis. Here we have echinocandins that blocks beta glucan synthase. This enzyme beta glucan synthase is involved in the formation of beta 1,3 glucans. And the next category is about the drugs that alters the cell membrane permeability. We have polyenes which has amphotericin B and nystatin. What they are doing is that they bind with ergosterol and forms an artificial pore in the membrane. In this way they are altering the permeability of cell membrane. Polyenes are interacting with already formed ergosterol, while the remaining drugs from this class, terbinafine and azoles, they are not letting the ergosterol to be formed. Let's see the steps involved in the formation of ergosterol. First, we have squalene, which is converted into squalene epoxide by an enzyme squalene epoxidase. Then this squalene epoxide is converted into lanosterol, and this lanosterol is changed into ergosterol after few steps. What terbinafine is doing? It is inhibiting the enzyme squalene epoxidase. In this way, it inhibits the formation of squalene epoxide. And azoles, what they are doing? They are inhibiting enzyme 14 alpha demethylase, which is involved, which converts lanosterol into ergosterol. In this way they are altering the permeability of cell membrane. So as we have just discussed the mechanism of action of antifungal drugs, let's see their other characteristics. Let's start our discussion with polyenes. As we have just seen that polyenes target ergosterol in order to form artificial pores in cell membrane. So what would be the mechanism of resistance? If you are down regulating ergosterol, resistance can occur. That's what resistant fungal strains appear to be. Resistant fungal strains appear to have low ergosterol content in their cell membrane. Let's see the clinical uses. Amphotericin B has the widest antifungal spectrum of any agent. Despite being widest antifungal drug, the thing that has limitized the use of amphotericin B is its toxicity. Amphotericin B is drug or co-drug of choice for many systemic infections that are caused by Cryptococcus, Aspergillus, Blastomyces, Histoplasma, Mucor, and Candida albicans. But because of its toxicity, amphotericin B is used for a defined period of time, and after that it is switched with other antifungal drugs. There is only one example of synergy of antifungal drugs. This is the combination of amphotericin B and flucytosine. Amphotericin B is often used with flucytosine to treat meningitis, cryptococcal meningitis. We use flucytosine not just because of its synergistic action but also because of the fact that in this way we can reduce the dose of amphotericin B in order to reduce its toxicity. Local administration of amphotericin B with minimal toxicity has been used in the treatment of eye infections like we have keratitis and mycotic corneal ulcers. But keep it in mind that nystatin is too toxic for systemic use. Nystatin is used topically for localized infections like we have candidiasis. Let's see the pharmacokinetics. Amphotericin B is poorly absorbed from GIT. That's why it is generally given by slow IV infusion. It is widely distributed to all tissues except CNS. Elimination is via hepatic metabolism as well as through renal. Small fraction of drug is excreted in the form of urine. Half-life is almost 2 weeks. As only small fraction is excreted in the form of urine, so dose reduction is required only in severe renal dysfunctions. About the toxicity, there are some infusion related, like during intravenous infusion, fever, chills, muscle rigor and hypotension can occur. That is because of histamine release. These all side effects are because of histamine release. That's why before giving amphotericin B, patients are pre-treated with antihistamines, adrenal steroids, or with any kind of NSAIDs in order to reduce these infusion related toxicities. And then there are dose dependent toxicity like nephrotoxicity, which includes decreased GFR, tubular acidosis, decreased potassium and magnesium because of reduced erythropoietin, anemia can occur. There are also some neurotoxic side effects, which includes seizures and neurologic damage. Our next drug is terbinafine. As we have seen in the diagram that squalene is converted into squalene epoxide by an enzyme squalene epoxidase. And this squalene epoxide is converted into ergosterol after few steps. What terbinafine is doing? It is inhibiting this squalene epoxidase enzyme. In this way, it is reducing or decreasing the synthesis of ergosterol. Let's see the clinical uses of terbinafine. It is present in oral as well as in topical form. Terbinafine accumulates in keratin and it is active only against dermatophytes. Dermatophytes are such fungi that require keratin for their growth. Terbinafine, Terbinafines are more effective than griseofulvin in onychomycosis. Onychomycosis is it is an fungal nail infection. We will study about griseofulvin in our upcoming videos. Let's see the side effects. Terbinafines cause gastrointestinal distress, rash, headache, and one more. The patient that are taking terbinafine, they will complain about their taste disturbance. This is also a side effect of terbinafine. We will study our remaining antifungal drugs in next video. Thank you. Allah Hafiz.